The Insurance Regulatory and Development Authority of India has removed the age cap on buying health insurance policies from 1st of April this year. Earlier, individuals were restricted to purchasing new insurance policies only until the age of 65. However, after the recent changes that have come into effect from the 1st of April, regardless of age, everyone is eligible to purchase a new health insurance. The move by the Insurance Regulatory Authority aims to create a more inclusive healthcare ecosystem in India and to encourage insurance provider companies to diversify their product offerings. This is a big move that has come about, and this will perhaps cover about roughly 65 crore people who are who are senior citizens and are not covered. Currently, only 8.6% of country's population was over the age of 60 years at the time of the previous census, which was 2011. By 2015, this proportion is to increase by 19.5%. So a large number of them can now be covered under medical insurance. Currently, 60 individuals above 65 did not have this advantage, though few of the insurance companies still offered, but at a very high premium. I am joined at this hour by Dr. Shiranjit Chatterjee, who is a senior consultant of internal medicine at the Indraprastha Apollo Hospital in New Delhi. Dr. Chatterjee, for every company, it is for every company to give an insurance, right? And because earlier few companies would give it, but at a very high premium. But right now, everyone has to be giving the medical insurance above 65 years. That's right?
Yeah. So it's a very welcome move, I must say. But we have to see as to what these insurance companies are really doing, because all these earlier things that used to happen would really be very restrictive. They would cut off half of the diseases. And as you know, as you go above the 65 years of age, quite a few people are suffering from quite a few illnesses. And if they all are said that they are the points which cannot be covered, then it's a huge thing, because then most of the diseases are not covered. So the IRDAI also has to see how to cover all the pre-existing illnesses at some stage of your age, and be more friendly for the consumers.
Will the selection be now, even though the waiting period with pre-existing medical conditions have been reduced? But how rigorous would you expect this to be?
See, sometimes experience with insurance can be really. We have seen while working in the hospital that working with these insurance things, they ask so many questions, and at the end of the day, they would reject. We have been paying such a high premium, and I would expect that it would be still a reasonably high premium to be paid. I would expect that the insurance companies, obviously under guidance of the IRDAI, become more friendly to their users, and the questions and basically when they reject claims, they have to be much more careful, because even after you are paying so much of money, if it gets rejected when it's really needed, it is a huge issue. So although it's a very welcome move that above 65 years people are being covered with by insurance companies, but it has to be really made friendly, to be user friendly.
Well, IRDA has said that the targeted policies for seniors and millennials will reflect a nuanced approach to diverse needs. Could you tell us a little more about how nuanced the approach should be, and what are the things it should really focus on, and under what buckets we should look at getting these kind of benefits?
See, one is that there has to be at the most maybe a buffer period for your older illnesses, that beyond maybe 2 years or 3 years, maybe I would say beyond 3 years or something, your older illnesses are covered. then people, the room capping and all that has to be also very carefully done, because otherwise you may not be allowed to stay in a room. Then there are other costs which are included in the hospital expenses. They have to be working with the hospitals to find out as to what all can be covered, because quite a few things nowadays are not given by these companies, and quite a few things are rejected by them. So the amount of money which the patient finally gets after insurance clearance, also if they even allow it, is sometimes quite a measly amount. So all these things need to be really seen into, to make it consumer friendly. They have to be when they basically deduct money, it has to be seen that it was all applicable, and what is so that it is that the essential money is at least paid to the consumer. So they have to really, the IRDI, the hospital associations, and the insurance companies have to work together to make it friendly, because otherwise, as our experience tells us, that it can sometimes be it is not friendly at all in quite a few circumstances.
Dr. Chatterjee, while we are talking about insurance cover for the senior citizens, one of the big things that probably we need to discuss is the access for the middle class. Most of the middle class consumers don't access health insurance because of higher premiums. And now we are talking about an age group that is above 65. How effective then one can hope for the policy to be for the middle class to access such a thing, such a product?
Yeah, see, as I said, it all needs to be worked out. It sounds very good. It's a very good move by the IRDI. But if the premium is more than 2 lakh rupees or something like that for a for a measly amount, then quite a few people won't be able to afford it, and quite a few people won't even avail of this of this facility. So everybody needs to really sit into it and make it more fruitful for all the people, including the consumers and everything. And obviously, it cannot be a loss for the hospital. It cannot be a loss for the insurance company. So they have to work out a way so that it is made more friendly, more pocket friendly as well, so that more and more people can avail of it, and the healthcare system reaches everybody, at least most of the people in this country.
Doctor, while we are, talking about healthcare for 65-year-old, I do not see a bullish approach among the young Indians who are getting into jobs, getting their first salary, and buying a health insurance, because there seems to be certain kind of a mindset, or I would say a block towards buying health insurances. How can that really change?
No, I think it is changing a bit. Over years, I have seen, because I have been working in a private hospital for now 27 years, I have seen definitely a mindset change in people. Obviously, it hasn't changed that much. It needs to change much more. It is to be taken as an investment rather than really that the health comes as an investment. It is not really an expenditure. And because once you fall sick, and you want to avail of the best of services in private hospitals, and a good treatment, a good accommodation, clean environment, you need to spend some money. I think it is changing over the last couple of years. This is what I have seen. More and more people are getting into health insurance, and that's how they're affording private hospitals as well. At the same time, I must say that the age group has really increased. The survival time in our country has really increased. In the last couple of months, I have treated so many people who are above 100 years of age. So it is such a good move that above 65 people are covering. And I was very happy when they told me that they have started to cover more than 65, because it came as a change for me that in the last 6 months, I must have treated at least 15-20 people who were above 100 years of age, which was not the story earlier. So the age group has to change. Younger people have to realize that it is an investment, not an expenditure.
Right.
More and more people should get an insurance of a good amount, so that they can avail of these services on a long-term basis. And the younger age, and the younger you are, if you started at 30 years of age or 25 years of age, the premium money is much lesser.
Absolutely.
And it should be, but you have to be very careful with your agents and all that. When they say that, you should, before you change from one policy to the other, they would say that they will all be carried on. Be very careful. Half of the time they don't carry on from one insurance company to the other. So when you are young and you're choosing one company, see to it that there's a good company. When you're changing again see to it that everything is carried on. It's not a very good idea, because very few times the middlemen and all that, they try to change it, and when you finally need it at the age of 45, they'll say, oh, you changed our insurance company, you're not covered for this disease, that disease. So but once you're guided well and there are clear cut instructions,
That's
and
very
as I said,
important.
the regulatory authorities has to see into it, then it's a very, very beneficial thing.
Absolutely. It's a welcome move, though, by our IRDAI to have 65-plus-year-old citizens under the ambit of health insurance, though a few of the health insurance companies were offering health insurance for 65 plus, but now everyone can avail of that. However, the premiums will be much higher. Thank you very much, Dr. Chatterjee, for joining us on the broadcast.